Welcome back. World Breastfeeding Week runs from the 1st to the 7th of August. So we're ending that awareness campaign today. And part of the awareness we've wanted to create is that breastfeeding has been proven to increase the health and immunity of babies. But the number of women willing to breastfeed in South Africa is alarmingly low. The South African Medical Association says there has to be a concerted effort to encourage breastfeeding. It says this will improve all aspects of public health. For more on this, the association's chairperson, Dr. Angelique Coetzee, joins us now. Doctor, thank you very much and welcome. Thanks for your time this Saturday morning. So I'm always baffled by the fact that there are such alarmingly low numbers of women willing to breastfeed. It's free. So how did we get, and this has been quite a while that we've been having these conversations, but I want to just go back a couple of years and say, how did we get to this point? Why have women been historically discouraged from breastfeeding?
Good morning, and a good morning to all mothers out there, whether you did breastfeeding or not. I think what is important, first of all, to say, you're still a good mother, whether you breastfeed or not, because there's this thing about if you don't breastfeed, you're a bad mother. And I think that should be addressed as well. And as this can also lead later on in life, having problems between you and your child because you feel guilty you didn't breastfeed. But if we come back to breastfeeding, is actually, especially during the COVID-19 pandemic, one of the most important things that a mother can do after giving birth to her child. There's a lot of things, I'm speaking in relation of the South African context. You know, within the first hour after you have given birth, you need to get that baby on the breast. So if we look at the current situation in most of the hospitals, the nursing staff are overwhelmed. We have very young teenagers getting pregnant, don't understand the importance of breastfeeding. There's no one that can actually help and guide them in the busy clinic around the importance of breastfeeding. There is a problem when they go home. There's not enough social support. I must say, you know, when I had my first baby, I also thought breastfeeding is easy. You just put the baby on the breast and everything goes okay, because that's what's happening on the television series, and that's what's happening to my neighbor next door. Everything seems so easy. And no one is telling you that it is actually difficult, but you have to carry on. It will be for the first 2 or 3 days, and you will find the correct way of the baby to latch onto your breast, and it will be fine. No one ever told you as well that it takes about 20 minutes per feeding. The baby wants to feed, especially in the first 6 weeks, every 2 to 4 hours, and you have to sit with the baby on your breast. So it's that emotional preparedness to help and assist this young mothers. I must say, after your first baby, it is very easy to breastfeed. It then sort of becomes natural, but it's to get the first mamas to adhere to this. Then another very important thing that we tend to forget, that the quality of breastfeeding is linked to what you are eating. And I think here, it should be a public health problem. We need to make sure that the vitamins providing to these mamas, especially the majority of our mamas, first time, doesn't have access to an antenatal clinic. They don't have access to these exercises and what you do before you know what to expect during birth and afterwards.
Dr.
So if we do not supply them...
So you're telling me that there are actually quite a number of challenges that make it very difficult for especially new mothers to breastfeed. And just from personal experience, I was at an airport, in a small regional airport recently, and there were absolutely no breastfeeding facilities, which meant a mother had to breastfeed in a toilet cubicle. Now, that's something we've seen. It's an ongoing problem that public spaces, offices, places of work don't make provision. So that's another added challenge. It's been years since we've been having these conversations. Why are we making progress, A, and why are we not making progress as quickly as we would want to?
I think we don't make progress, and I think it's lying, again, unfortunately, in the health sector. We are not training the nursing staff correctly in helping to assist these young mamas. Again, children getting children. It's very difficult to get them to understand how important breastfeeding is, especially in the first 6 months. If the mama gets the correct vitamins, and again, we have to accept the fact that the majority of our young mothers are from the public sector. You cannot just give them iron supplements. You have to make sure that you give them a good multivite. Rather invest in a good multivite for these mamas that needs to breastfeed, especially for the first 6 months. That will enhance the quality of the breastfeeding. It will add benefit to the baby. The mother will feel at least I'm getting more or better looked after for, in the terms of vitamins. Remember, you need at least 500 more calories if you want to breastfeed. And you cannot supplement those calories with bread. You have to supplement them with the correct vitamins and minerals. And
Coetzee,
that needs to be addressed.
Unfortunately, we have run out of time. It's such a complex issue, but we're always grateful for your time speaking to you every week, every year on Breastfeeding Week to try and raise awareness. Thank you again for your time. Dr. Angelique Coetzee is the chairperson of the South African Medical Association. A very important topic. We cannot stress it enough. A lot more needs to be done to make breastfeeding easily accessible to new mothers.